The House Appropriations Subcommittee on Public Health will come to order. Will the clerk please call the roll for today's attendance?
Chair Green.
Present.
Representative Kuhn.
Here.
Representative Maddock. Representative Slaw.
Present.
Representative Steele. Representative Price.
Here.
Representative O'Neill.
Present.
Mr. Chair, you have a quorum.
Representative O'Neill moves to approve the minutes of the April 22nd, 2025 meeting. There being no objections, the minutes are approved. At this time, I would like to ask Sydney Brown, our House Fiscal Analyst for our subcommittee, to give us some introductory comments and to talk to us a little bit about this line item in the budget.
Good morning, Mr. Chair, members of the committee. Sydney Brown, House Fiscal. I'm just going to give a quick overview of the Child Advocacy Center's appropriation line and the Child Advocacy Center supplemental grants appropriation line. So starting with the Child Advocacy Center's line, this is $1.4 million in restricted funding. That's the Child Advocacy Center's fund. The funding supports child advocacy centers across the state for child victims of sexual abuse. The restricted funding comes from a earmark of the civil infraction fee revenue. It's about 1.9%. Funding is administered by the Domestic Violence and Treatment Board. There are currently 30 accredited CACs or around 30 accredited CACs in the state. In fiscal year 23-24, 30 counties were served from this line. In fiscal year 24-25, so far, 28 counties have been served from this line. Funding is allocated as grants to child advocacy centers and child abuse councils based on the number of children served in the area and prior service levels. In fiscal year 24-25, $212,800 has been spent so far. The services provided by the child advocacy centers is forensic interviewing, medical evaluations, case management, victim support, family advocacy, therapy, and mental health supports. I've also included a table of actual expenditures from 2023, so you can see what's being spent for the last 3 fiscal years. Fiscal year 25 is obviously ongoing, so that number is what has been spent so far out of the Child Advocacy Center's fund. The Child Advocacy Center's supplemental grants line is $2 million general fund. This line used to be part of the regular Child Advocacy Center's line, but then it was pulled, all the general fund was pulled out to make its own line in fiscal year 23 to give more flexibility on administrative spending to child advocacy centers. With the Child Advocacy Center's fund, they're only allowed to spend about 10% on administrative costs. So the general fund was meant to assist with that. This also is provided as a grant. Originally, it was just $1 million. It was increased to $2 million in fiscal year 24. Funding is allocated based on the above criteria that I included above. And so far for fiscal year 25, $890,100 has been spent so far. This line also has related boilerplate that I have included below that basically just details the distribution formula that is required for distributing this funding. I also included to the members the copy of the Child Advocacy Centers Act, which is Public Act 544 of 2008. And with that, I can take any questions.
Ms. Sidney, a technical question here. We have allocated $1.4 million of restricted funding. However, it seems only about $500,000 goes out every year. Where does that other $900,000 go?
It either stays in the, I gotta remember what the fund is called. It's the Justice Advocacy Fund. I know I'm getting it wrong.
That's fine.
But it's a fund that filters into the Child Advocacy Center's fund. So if that money is not used, it's either going to stay in the Child Advocacy Center's fund or it's going to stay in that larger fund.
All right. And again, I'm sorry for, so with that fund, it's growing at, I mean, apparently with this, it's growing at $900,000 a year. What is the purpose of that fund? I mean, is it like we're trying to get money down to our child advocacy centers, and it seems like it's getting hung up in a fund, and only about a third of it is getting down to our child advocacy centers? What is happening? What is the purpose of those other 2/3 dollars? What is the purpose of that fund? Is it just to grow in perpetuity, or do you have any insight into that?
I would say with the 1.4, you're talking about the Child Advocacy Centers fund.
Correct.
Okay. So with that 1.4 million, the authorization is given for 1.4 million, so they can spend up to 1.4 million, but they can certainly spend less. And so child advocacy centers that are granted money from the department that go through the grant process will receive that funding or however much funding they need based on children served and the service area. So if the department spends less than 1.4, it's not necessarily that money is lapsing or that we're constantly accruing whatever's left over. But typically, if there is money left over in a year, I would say in fiscal year 23, there was like 130,000 left over. It just gets rolled over into fiscal year 24.
Okay. We may end up talking offline on this.
That's fine.
So, Representative Kuhn?
Thank you, Chair. Just to follow up, what does the Justice Advocacy Fund do with this $900 million each year?
There's a number of earmarks that are required in statute for the Justice Advocacy Fund. Again, I'm probably getting the name wrong, but it's a number of public safety, juvenile justice, child advocacy centers. That's all I can remember off the top of my head right now.
Great. Well, if you could fill us in a little
Yeah,
bit more, I'd appreciate
absolutely.
it. Thank you, Mr. Chair.
Representative Slaw?
Sydney, just a question for you about that, the dollars that are in the restricted fund. Is it that there isn't, so part of what I heard you say is it's related to administrative costs. They're only allowed to do a certain amount of administrative costs out of that fund?
Out of that restricted fund, yes.
So is it partly that there were, I guess, are we seeing some sort of administrative fees going someplace else that could be coming out of this if there was a change in the way it was drafted? Or, I mean, I'm looking for the utilization of this funding, and I'm just wondering if there's a way that we could do it better than we're doing it right at the moment.
I know there was a conversation in the fiscal year 25 when the language for the supplemental grants line was changed to ensure that utilization is increased or working properly. I can't say for certain what the issue was with administrative costs from the restricted line. All I remember from that time was that there was issues with using the money for administrative spending, or administrative spending exceeded 10%. And so pulling the general fund out made all the money that comes out of the Child Advocacy Centers line restricted, and all the money that goes out of the supplemental grants line general fund, so they can use that whole pot for administrative spending or whatever else they need it for that the restricted does not allow for.
Representative Price?
Thank you, Chair. How many counties do CACs serve, and what counties do they not serve? What are the issues or barriers that prevent them from serving all counties?
I can tell you that out of the Child Advocacy Centers line, there was about 30 counties served in 2024 and 28 currently being served for 2025. That goes to both Child Advocacy Centers and child abuse councils, child protection councils. What barriers they might be facing to receiving funding, I think, is a better question for the nice people behind me. I've not heard anything about barriers this year, so I will let them answer that question.
All right, thank you, Sydney. This committee is starting to take a little bit of a turn. In general, for the first several weeks, we were looking at there were heavy departmental things that the department did, such as lab services and bioterrorism preparedness. Now, this turn, we're gonna start looking a little bit under the hood of things that maybe we do not want to even acknowledge happens in our society. And we're looking at the next couple of sessions. This session, we're going to talk to the Child Advocacy Centers. To be blunt, my goal as a legislator is to put the Child Advocacy Centers out of business. I don't want them in business because I don't want our children abused. However, the stark reality is we're dealing with a very sick society. And I appreciate the work that our Child Advocacy Centers do. And I've asked them to come give us an overview and then to field some questions regarding their funding model, and the work they do in our community. So with that being the case, let's see, we have Alex Brace, the Executive Director of Small Talk CAC, Matt Henry, the Executive Director of Lapeer CAC, Tricia Schuster, Program Director at Care House CAC, Rachel DeWitt, the Executive Director at Ottawa CAC, Josh Bissell, the Director of Multidisciplinary Team Training and Initiatives, the Child Advocacy Centers of Michigan. And so that being the case, I'm not sure, I realize we don't have 4 or 5 chairs up there, so I'm assuming that y'all have, I'm sorry, my wife's from Virginia. I'm assuming that you all have a plan as to how you want to do it, so I can just turn it over to the organization at this point.
Good morning. Thank you, Mr. Chair, fellow members of the subcommittee. My name is Josh Bissell. I'm the Director of Multidisciplinary Team Training and Initiatives for Children's Advocacy Centers of Michigan. My agency is the state chapter that represents all 40 children's advocacy centers around the state. It brings a lot of hope to me and my colleagues today to have this privilege to share this time. I really appreciate the invitation to present this morning. Over the next few moments, my colleagues and I want to take you on a journey of understanding, one in which you'll come to know the Child Advocacy Center model and its immense impact on public safety and community health, the risks facing Michigan without your support, and the incredible opportunity this committee has to directly impact Michigan's future. You'll hear from these CAC leaders about the impact of CAC programming, and they'll share how funding shortages will harm their communities. And finally, CACMI, the chapter's board chair, Alex Brace, will wrap up our discussion today by highlighting the opportunity this committee has surrounding the CAC supplemental funding ask we've made. But first, allow me to set the stage. When a child suffers abuse, their world fractures. Their sense of safety, trust, hope, gone in an instant. At the heart of our state's response to child abuse are children's advocacy centers, CACs. They bring together a multidisciplinary team, or an MDT, consisting of law enforcement, child protective services, mental health professionals, victim advocates, trained forensic interviewers, medical experts, and prosecutors. At CAC, we believe that no single agency can address child abuse alone. It takes all of us working together side by side. CACs coordinate these multidisciplinary teams. They ensure that there's monthly review of active child abuse cases, comprehensive case tracking and accountability, collaboration at every turn of the process. Their role is simple. No child falls through the cracks. But coordination alone, that's not going to do it. CACs ensure that teams have access to the latest training. They foster learning among community partners. They drive constant professional growth. They help local teams regularly review and update their investigative protocols, adapt to new challenges, and eliminate the barriers that hinder justice. And crucially, CACs care for the caregivers. We recognize that frontline responders are carrying invisible wounds. We support law enforcement and our MDT partners struggling with secondary traumatic stress. We help them sustain the emotional resilience they need to do this difficult work. And at the center of the CAC model is the forensic interview. It's the opportunity for a child to tell their story in a way that is trauma-informed, developmentally appropriate, and non-suggestive. This interview isn't just a conversation, it's a critical piece of the investigation. Law enforcement and child protection partners are part of the process, ensuring the child's experience is captured fully without re-traumatization. These interviews are recorded and monitored in real time by investigative team members. CAC interviewers receive peer support and peer review, and continuing education to ensure they're upholding the highest standards of practice. There is no other entity in Michigan that holds forensic interviewing to this rigorous standard. No one else but CACs. But a child's journey isn't going to end with disclosure during the forensic interview. CACs make sure that children and families have access to trauma-focused medical and mental health care. Many centers employ dedicated victim advocates and therapists who walk families through the long and overwhelming criminal justice process. We develop safety plans, conduct risk assessments, we connect families to resources, and we help children and their families reclaim their lives. I usually tell folk I'm working with that CACs are nestled between healing and justice. There's not another entity that really embodies that dual mission, supporting a child's recovery while also building a strong, collaborative case for prosecution. CACs are unique. And the data backs it up. Communities with CACs see higher prosecution rates, better treatment outcomes, greater access to services, and fewer duplicative, harmful investigative efforts. So we want to ask you today, do you want to live in a Michigan without CACs? Because the reality is, without the support CACs need to continue, our children are going to face a fragmented and confusing and re-traumatizing system. Families will have fewer supports, and our collective ability to bring perpetrators to justice is weakened. Don't take my word for it. I'm going to introduce to you, and it's my honor to introduce to you, the first of the CAC leaders you're going to hear from today, Matt Henry. He's the executive director of the CAC in Lapeer County, and he's going to share how the vital work is making a difference every single day in his local community. Thanks so much.
Good morning. My name is Matt Henry. I'm the Executive Director of the Child Advocacy Center of Lapeer County. I am by far the professional junior among my esteemed colleagues here, invited almost solely because I work in the territory covered by Chair Green, so thank you for the invitation. I happen to live in the district covered by the other Representative Green. Yes. She spells her name wrong, I'm sure you've heard. Earlier this month, at an event in Lapeer honoring survivors for Crime Victims Week, a teenage girl was waiting to speak to the audience and was introduced backstage to one of our county's assistant prosecutors and me. Her initial cold apprehension dissolved when the sheriff's lieutenant introducing us simply said, "These guys are from the CAC." This girl had been interviewed at our advocacy center and received therapy services just before I started there. She was continuing on a journey of remarkable courage, having found safety from the sexual abuse at the hands of her father, healing with the work and the relationship with our therapist, and justice from our partnership with law enforcement and prosecutors in our county. It had been a journey that so far had taken her from a place of fear and deep suspicion of all men to a place where, upon learning that these guys are from the CAC, meant that she could make eye contact and look at us and say, "Thank you." I've been in my role in the Child Advocacy Center of Lapeer County for just 14 months. For the 14 years prior, I was the director of a nonprofit camp and retreat center in Almont Township in the southeast corner of Lapeer County. You will have discerned by now that I have an accent that is likely not from the southeast corner of Lapeer County. And if your imagination takes you to Australia, you're on the right track. My particular journey to here is not relevant other than to say that my career immediately prior to moving to Michigan was as a child protection specialist in the Australian state of New South Wales. Then and there was no child advocacy model. Child protection workers operated in isolation from law enforcement, had no ongoing working relationship with public prosecutors, and paid no attention to mental health services as an idea. This was a system I saw failing children and therefore failing us all repeatedly. After many years of coaching camp professionals towards better protective practices and standards, I was very pleased to find the Child Advocacy Center right at a time where I was making a professional shift for myself. This one girl's story that I shared briefly is one of hundreds. She'd been hurt, and when a child is hurt in this way, the Child Advocacy Center becomes a place of safety, a place of healing, and a place of justice. The stories are too many and in many ways consistent. The other consistent story that I've heard in these months is, and in fact even in interviewing for the position, is that the funding for Child Advocacy Centers is under threat. When a child is hurt, I recognize that as a failure of us as adults. And when a child is hurt, the Child Advocacy Center begins the work of safety, the work of healing, and the work of justice. And I can think of no more important work. I'm going to introduce to you Tricia Schuster, who is the Vice President of Programs in Oakland County with an organization called Care House. Thank you for letting us be here today.
Good morning. So I'm Tricia Schuster. I am the Vice President of Programs at Care House of Oakland County. We are located in Pontiac, Michigan. As those of you who probably know, Oakland County is a very large and very populated community. As a CAC, we are the only CAC in Oakland County. We work with 47 police jurisdictions, over 100 Children's Protective Service workers, as well as the Oakland County Prosecutor's Office. I am thrilled and blessed to say that we have a wonderful working relationship with all of those entities. As Josh already described our multidisciplinary team, that's what the Care House does. What all CACs do is they provide an avenue for those entities to come together, work together, and reduce the trauma that goes on with children to have to be re-interviewed or to have to basically talk to multiple people. I also want to mention something that also happens that people don't think about. It is incredibly important that these children have an opportunity to go to a center that is child-friendly and neutral. A lot of these families, I'm going to take it from the parents' perspective or caregiver's perspective, somebody shows up at their door or calls them and tells them maybe 1 or 2 days before they go to the center that something terrible may have happened to their child. They may have seen it, they may have heard it from someone else, or they may have witnessed it. These parents are terrified. They have no idea what happened. They have no idea if the worst thing they can think of just happened to their child, but they're told to go to this building and their child's going to be interviewed. There are also parents who are told the exact same thing and learned in the exact same way, but may have had some involvement with law enforcement, Children's Protective Services, and maybe that didn't go well. But they're still terrified for a lot of reasons, and they have to go to a building where their child needs to be interviewed. As Children's Advocacy Centers, we open those doors to all of those people, with all of their baggage, with all of their experiences. Those children are terrified because the parents are terrified. We welcome them in. We bring them into a child-friendly facility that has none of the markings of a police station. They aren't getting interviewed at school. They're not being interviewed in the hospital. They're being interviewed in a very calm, friendly setting that is very neutral. They don't have to sit in a room with all of those investigators. They're able to meet people who are knowledgeable and friendly. Those caregivers are also then addressed as far as the children are being forensically interviewed. We know we take care of the kids and everything they need, but the caregivers are also talked to by victim advocates. We ask them, where are you at? How are you doing? What do you need? What does your family need? You know, and most of the time what we're doing is actually answering questions. Most parents, like I said, are terrified. And what they want to know is, what do I say to my child now? Why didn't they tell me? How did I not know? And that's really what we hear from most of these families. Children's Advocacy Centers are with these families from the time they find out something all the way through the process. They're involved with the multidisciplinary team when they're there at the center, and then we continue with services afterwards. We provide them with mental health services, support groups, medical services if needed. We arrange all of that, and we have our people with them through every step of the way. It is a vital service to these families so that we can make sure that they not only survive, but they thrive. Kids are incredibly resilient, and if we provide them these resources, they can totally come back from anything. I believe that to my core. I've been in the field for 31 years. I can tell you I was here and doing this work before Child Advocacy Centers came into play, and I've been involved with Child Advocacy Centers since 1999. I'm a proud forensic interviewer as well as a therapist, not to mention watching over the programs. So I know the services that we provide are vital and are absolutely essential to these families so that it's a coordinated effort by all the investigators so that it can reduce how much the kids have to be traumatized and we can let them go on to be kids. So all funding is vital. We are under threat for the funding, and it does mean we will have reduction in services based on what we have to deal with. But we will always be there for the children and families. Thank you very much. I'm going to introduce Rachel DeWitt, who is from the Ottawa County CAC.
All right, thank you so much for this opportunity today. As Tricia said, I am with Ottawa County, which is represented by Representative Slaw. So thank you so much for just the chance to talk to you about our work today. I am the executive director of the CAC in Ottawa County as well as a therapist. I started my journey there in 2010 as a counseling intern, and here I am now. It's really cool to think about how far I've come, and I just am so passionate about the work of the CACs. For Ottawa County, I want to give you a few of our impact numbers to begin. We reach over 19,000 elementary age students in almost all Ottawa County elementary schools each year with our prevention education. They learn about body safety, safe, unsafe touches, and they also learn to listen to their gut instinct and go tell a safe adult if something makes them feel uncomfortable. We also train over 1,500 adults each year in how to prevent abuse, organizational best practices to keep kids safe, what grooming behavior looks like, how to listen well to a child, and how to make a report of abuse. For our intervention side, in 2024, we conducted 340 forensic interviews. In October 2024, we set a record with 38 forensic interviews in 1 month. We averaged 200 counseling sessions every month, and we experienced a 25% increase in demand for counseling last year. The approximate cost for a child to receive 1 month of CAC services is $1,500. That includes the forensic interview, a medical exam, family and victim advocacy services, and 4 counseling sessions. And I am proud to say that all of our services are offered free of charge. While I believe these numbers are impactful on their own, I also want to tell you about a client of mine. Audrey came to me at 10 years old for counseling. She had been sexually abused by her step-grandfather since kindergarten. She was threatened, and she was told that if she said anything about the abuse, they would both go to jail. He also forced her to smoke marijuana and then told her she would get in trouble if she said anything because she was complicit. When her abuser was out of the home for a few days, Audrey took the risk and made the brave choice to speak up and tell about her abuse. She was met with belief and support. She came to see me for counseling after her forensic interview. When I asked Audrey, "What gave you the courage to say something?" she said, "I heard in a prevention message at my school that if I told someone, I wouldn't get in trouble, no matter what." She was supported as she prepared for trial. Her offender was so confident in his power over her that he made her so small that he would absolutely be able to get away with this. However, that is not the case. Audrey took the stand and boldly told her story, and he was convicted on all counts. We were working on her victim impact statement for sentencing, specifically the part where kids talk about what they'd like to see happen. And she said, "I want to see him walked out in handcuffs. I want to see him go to jail because then I will know I'm finally free. Then I can go back to being a kid again." and that's why we do what we do. We are determined to restore as much childhood as possible. We believe that every child deserves a chance to have a healthy, happy childhood that doesn't lead to an adulthood consumed by recovery. Through our abuse prevention and intervention programs, we are fighting for childhood. We are fighting for healing, justice, and safety on behalf of those we serve. And if not CACs, then who? As Tricia mentioned, 27 years ago, before CACs existed, kids were interviewed about their abuse in the back of a police car or at the police station. Sometimes interviews happened in the home with the abuser present. Parents would have to seek out each discipline separately and figure out on their own how to navigate life post-disclosure. The services of the CAC are uniquely vital to our communities, offering coordinated expert care that is child-centered, developmentally aware, and trauma-informed. Healing is maximized, but also the negative impact is minimized as much as possible so that intervention does not contribute to the trauma already experienced. My colleagues here today will appeal in different ways about the importance of funding children's advocacy centers, but I want to highlight the value of what we provide through the lens of generational trauma. There is a cost, a lifelong cost, to kids not being met with belief and support when they make the brave and bold decision to tell about abuse. There is a cost to kids carrying undisclosed and untreated trauma into adulthood, and this impacts generations to come. This is often defined as ACEs, adverse childhood experiences. According to the National Institute of Health, the national economic burden of ACE-related adult health conditions is $14.1 trillion annually. One of my favorite parts of counseling is when I get to say, this can end with you. You can either choose to repeat what's familiar, or you can decide to do things completely different. I love having the opportunity to get kids excited again about their future, communicating to them that they are deserving of something so much more, and empowering them to design a life and a family that they love, that is free from abuse. Your investment now is an investment in the future of Michigan's children. I want to thank you for your time and attention today, for turning towards and not away from this heartbreaking reality. Thank you for supporting those who do the daily hard work of keeping kids safe in Michigan, for committing to the preservation of the childhood experience, and for boldly declaring individually and as a state, not on our watch to child sexual abuse. And now I'd like to introduce Alex Brace, our CACMI Board Chair and Small Talk Executive Director.
Good morning, Representative Green and members of this committee. Excuse me. Thank you for the opportunity to speak with you today. As mentioned earlier, my name is Alex Brace. I'm here as the Executive Director of the Small Talk Children's Advocacy Center here in Lansing, and I also serve as the Board Chair for the Children's Advocacy Centers of Michigan, representing all 40 Children's Advocacy Centers here in Michigan. Child abuse is a public health issue that deserves our immediate and constant attention. The loss of CACs or the reduction of services to CACs will have serious ramifications that go beyond the work and beyond this present moment and are ones that will have a direct impact on our public safety. The mental health consequences of children suffering from trauma are significant. If unaddressed, children will likely suffer from depression, PTSD, substance abuse, school failure, unemployment, criminal justice system involvement, and long-term physical health problems, all of which increase costs long-term and put pressure on existing systems that are already overburdened, like our law enforcement partners. The CAC model is one proven through evidence to be effective and impactful. Our CACs make our local communities safer by coordinating efforts of professionals across a variety of disciplines, healing children through mental health and advocacy services, and holding offenders accountable when they commit a crime as heinous as child abuse. As has been previously mentioned this morning, CACs offer trauma-based mental health services to children and families impacted by abuse. Starting my career as a therapist at our CAC 14 years ago, our mental health programming has always been a top priority for us. We have made a concerted effort to hire more therapists, each time hoping we can finally meet the need of our community. Even despite our best efforts, the need is ever increasing and the options for outside therapy are scarce, resulting in a wait list for treatment, which is currently about 4 months. And we understand that if that wait is too long, children and families will decide that those services are not necessary or not achievable for them. Even in my role as an executive director, I carry a caseload to maximize the amount of children that we can see. Even with these challenges, I have the honor of seeing what a coordinated, multidisciplinary, trauma-informed response can do for a child. It turns children who couldn't speak during their forensic interview into vocal advocates for children, for child abuse in their schools. It makes these children become adults who end the cycle of abuse when they become parents. And as one parent shared with me, it turns children who saw themselves as victims into victors. Yet, despite this critical work, our CACs are facing a growing funding gap. Today, respectfully, we are requesting a funding ask that has two key components. The first of which is a $6 million allocation to statewide to cover all of the CACs, up from a $2 million ask last year. This increase will help meet the rising demand for services, address workforce shortages, and reduce wait times for therapy, forensic interviews, and other interventions that keep kids safe and supports our community partners like law enforcement in their work. I believe it's important to highlight as well that, again, this commitment is one that will benefit every community in the state, not just one particular location. As has been mentioned a few times up here as well, we do have 40 CACs in the state of Michigan. There are 5 counties that do not have CAC coverage in the state of Michigan. And the second part of that ask is a one-time $6 million allocation to stabilize our centers in the face of a sharp decline in Federal Victims of Crime Act, or VOCA, grant funding. This bridge funding is essential to prevent disruption of services to vulnerable children while longer-term federal funding solutions are explored. In 2019, our state received $100 million in federal funds that went to all victim-serving organizations across the state. In these past 6 years, that number has been reduced by almost 80%. What this funding will allow us to do is fulfill the statewide mission of creating safe communities for our children and families to thrive. Funding like this takes the burden squarely off the backs of children who carry the tremendous weight of their trauma and gives that to the highly trained professionals, many of them who are here with me today, that can lead them on a path to healing. This funding is not an expense. It's better seen as an investment. Every dollar we spend on treatment and intervention through the work of CACs saves exponentially more in future costs to our state. Most importantly, though, it gives every child the right to heal from trauma. We all, on behalf of my colleagues here today, we want to thank you for the opportunity to share something with you that is so important to all of us. And most importantly, it matters to the children and the families that we serve every day. And we would be happy to take any questions that the committee might have. Thank you again for your time.
All right, I have a list of my questions, but we may have to take some of them because we could talk about this for a while. So I'm just doing some quick math. Looking at the Child Advocacy Center's $1.4 million restricted funding, $500,000, give or take, goes out annually to 30 different entities. My quick number math shows me that's about $16,666.67.
Sure.
Obviously, that doesn't cover your budget.
Yes.
So my question then becomes, you're carrying, you yourself and I believe everybody else are carrying a caseload. You're the director. You're recruiting. And apparently you're raising money. How much of your time, and this can sort of go amongst all of you, how much of your time is based upon, do you spend raising dollars, and how much of those raised dollars is your budget?
Sure, that's a great question. I'll speak for the small talk perspective, and I think if there's anybody else who would like to chime in on, what their situation in their county or their particular CAC is, I welcome them to bring that to the committee as well. I think, for our organization, I would say about 15% of our time is used for fundraising, but it makes up a pretty substantial portion of our budget. About 55% of our budget comes from grants, either from the state or from the federal government, and the rest needs to be fundraised. So that's either looking for, hosting a large fundraiser, once a year, and then looking at local grants and other grants to help kind of fill in the gaps to meet the need for our communities. So we have a fundraiser that we have been able to hire at our advocacy center, but that person is strapped. And, that also becomes a large part of my job as well, as kind of supporting the fundraising to make sure that we can keep the doors open, keep the lights on. As important as it is to make sure that children have access to all the services that we provide, they also need to have a space that is, has the lights on, and that we're able to pay for the rent, and that, kids can have a snack every once in a while. So I think those kind of things become absolutely necessary for us as we continue to, make sure that we're funding our CACs and making sure that these kids are taken care of the way they need to be taken care of.
Are those consistent numbers across industry?
So, do I come into the
Sure.
microphone or just?
Yeah.
Or just holler? Yeah. So in Lapeer, we're a much smaller county, much smaller staff. I would say about a quarter of our budget is fundraised. And if I thought about it, we also have a staff person dedicated to fund development. And if I thought about it from an opportunity cost perspective, what we are missing because of having to invest in that person is we're missing a full-time therapist. We also have a pretty deep waiting list for our children to receive therapy. Like Alex said, that often means we will lose them before we are able to serve them. And that's what we miss out on by needing to fundraise to keep it going.
Hello. Yeah, so Oakland County, we have about 45% of our budget we have to raise. And that goes through not only grants, so we have a grant writer that we've invested in. We've had to work with foundations and try to diversify as much funding requests as we can and spread that out everywhere. So approximately about 20% of my time goes towards those efforts. As Matt was already saying, some of that money is money that we've had to invest in the development as well as the grant writing to be able to diversify as much as possible, looking at some of these shortfalls. That has meant that, yes, therapy, we haven't been able to expand therapy services. As Alex was saying, we are running a significant wait list as well, and there's a workforce challenge there as well. So, yeah, a lot of our time is spent trying to figure out where more of that money is coming from, developing foundations and developing endowments, things like that, things that we've never had to really look at before. So significant amount of our time is going towards that.
I would say we're pretty consistent with what other people have mentioned. About a quarter of our budget comes from fundraising events in particular. Those are a huge lift. They do consume a lot of time and resources, staffing and money to put on the events too. And so we are working to decrease our reliance on major events and looking for different ways to connect with our community and to raise awareness and funds, but without that amount of time and effort invested in that way. For us, I know that we have been seeking out a lot of new grant opportunities, and with that comes just a considerable amount of time and energy that goes into reporting on that. And so we are always desiring more and more unrestricted funds, because those, I feel like, are best utilized and allow us to do the work and to not have to be so focused on reporting. With our large federal grant that all of us receive, it used to be one fund, and now it's broken into 6 different ones, I believe. And so now we're reporting to 6 different sources, and it's the same amount of money. And so in Ottawa County, we do have we have good administrative support, which is really helpful, but I know that most CACs are not in that position, and so that type of a requirement, that level of reporting, that's a huge, huge burden for CACs.
All right, Representative Steele has a question.
Thank you for testifying today. I'm not sure if you might be able to answer this, but it's kind of like looking at the state holistically versus individual counties and different centers. But statewide, do you know, it's a 2-part question, do you know how many children on an annual basis in which the state of Michigan sees at these advocacy centers? And my other question is, this is a very we're in the budget, so it's a very huge budget, Health and Human Services. And there's a portion of the budget is the child care for welfare and protection. My question is there overlap in the services providing in that portion of our budget and what you guys provide as services? And you might not be able to answer that, but maybe fiscal, or if you guys have an overall number too.
Sure. I can, I think for that second question, that is something that I do not know, but I think we can definitely find that answer out for you. I don't know if you want to add to first one.
I was going to say something similar, although it's my instinct that there is not overlap between that funding source and the services we provide, because simply there is no agency that provides the services provided at a CAC. So my instinct would be that there is not overlap, but we'll definitely follow up with specifics.
I think to speak to your first question as well, I know that we have, over the last 3 years, I think we have seen 27,000 children in the state of Michigan who have come to CACs to report their abuse. Yes, collectively.
And I guess as a clarification, the CACs, your specialty is not the general child abuse. Your specialty is more on the sexual child abuse. Am I correct with that?
Yes, I think that the majority of the cases that we do see are child sexual abuse cases. At our advocacy center, we do see kids who have been impacted by physical abuse as well. That represents probably about 20% of our the kids that come to see us. But there are CACs that also serve children who are victims of human trafficking, who have witnessed domestic violence. So as a safe place for children to go when they have experienced something traumatic, a CAC is a great place to go as opposed to, as was mentioned earlier, the back of a police car or police station, things like that. I think one of the other points of clarification that I think is really important as well is that when we talk about child abuse, child sexual abuse in particular, this is still a really taboo subject. It's one of the reasons why we're so grateful to be here today is this is a really important topic that does not get the attention that it deserves. And I think a byproduct of that is that children do not disclose their abuse out of fear and for a myriad of different reasons. So when we look at the numbers of 27,000 children that we have seen for forensic interviews in the last 3 years, I think it's important to consider that there are likely thousands more that have not disclosed for various reasons. I think there's a national statistic that I think 1 in 10 children will tell that they've been sexually abused before they turn the age of 18. So if we're really looking at, we're only serving potentially 10% of what is actually going on in our communities, I think that's indicative of a much larger problem that requires the attention of all of us to make sure that we're keeping kids safe and keeping our communities safe.
Can I have a follow-up? Are we helping the foster kids in our state, and then are these numbers going down or up if you guys track them to see if we're making progress in our education that we're offering as well? Thank you.
Yes, I think foster care kids for sure. Any child that has been, between the ages of 3 and 18, at least at our center, is eligible for a forensic interview in any of the swath of services that we offer. So whether they come from foster care, whatever community they come from, every child has access to our center. I think speaking about the numbers, I would say post-COVID, what we've seen is an increase in our need for services. I think ideally what we would love to see, because this is an underreported crime, is that if we're doing a really good job, we'll see an increase in the cases that we see because we know it's something that's happening, but it's getting reported. But then hopefully over time, through prevention efforts and stronger intervention efforts, we'll see those numbers come down. But I think we have a long way to go to make that a reality for us.
And sort of going down that line of thinking, questioning, and I'll move on in just a second. Are we talking about the perpetrators? Are we talking about the scary guy in a white panel van parked in a parking lot? Or what type of a perpetrator are we talking about?
That's a great question. We're talking about the person that lives in this child's house or their neighbor. or a family friend or a classmate. I think it's 88% of children will know who their abuser is. When you look at a crime like a homicide or a robbery or things like that, those are places where our law enforcement partners potentially don't know who the suspect is. In the cases that we work with and we see, I would say 9 times out of 10, we know who that person is. So I think I think we also have to change the narrative of who are these abusers, who are the people that we need to be looking out for, and what kind of conversations do we need to have. It's not to say that teaching kids stranger danger is something that we should not do. We absolutely should be doing that. But we also need to empower families and the professionals, adults in our communities to really understand what are the signs of child abuse. What kind of things do we need to look out for? What kind of behaviors do we have to look out for in potential abusers to make sure that we're keeping kids safe?
I just wanted to add to that, there's no profile of an offender. You couldn't look at someone and know, well, there's suspicion there. This happens in secrecy. This happens in families of every socioeconomic status, from the top of the UP down to Detroit. It's moms, it's dads, biological parents. It shows no prejudice where child sexual abuse occurs. And in fact, when you feel like your community is safe or free of child abuse, that's probably the community most in danger and most vulnerable.
Just wanted to weigh in on a couple of the last questions. First of all, I can tell you that anecdotally at the Children's Advocacy Center in Ottawa County, we are seeing an increase in cases where the perpetrator is the biological father or the biological brother, and those are really complicated. You can imagine there's a lot of additional needs in terms of mental health and safety that come up when it is somebody that is that type of a relationship. I would say, too, we are definitely making strides with our prevention education. It's really cool to see how, in many interviews, a child at some point will reference something they heard at school from one of our prevention messages. Not all CACs have a prevention program. We are one of those that do, and that it's pretty considerable part of our operations. We hope to expand into middle school and high school as well, but definitely with kids being educated that they have a right to be safe from abuse, that if something's happening, to go and tell someone. Just these basic things I think we take for granted that kids know, and they don't. And so it really does make a difference to educate kids about that. There's also an increase in peer-on-peer abuse. That is a pretty common dynamic. At the Children's Advocacy Center in Ottawa County, we also have a problematic sexual behavior program, and so we offer screenings as well as more intensive therapy for kids ages 3 to 9 that are exhibiting sexualized behaviors that we're not exactly sure where they're coming from, or if maybe they're saying things that are beyond what would be developmentally appropriate for their knowledge. And so we are able then to avoid having to go through the forensic interview process in those cases, but rather giving parents the support needed to minimize those behaviors before they really become a significant issue later on. The success rate with that early intervention is considerable too. Another thing as well that I think is really complicating cases now and making things more challenging is the phones, internet, that type of thing. So many of our cases, the vast majority, have some connection to something pornographic. We actually had a case come through not too long ago where there were pornographic images of toddlers on a dad's phone, and the toddlers couldn't tell us what happened, but we had that evidence. And so that is unique, I guess I would say, in terms of what we would investigate, but it's happening more and more that's the case. So I believe that's has a major impact on the cases that we're seeing, the volume of cases, and is a huge factor now in investigations moving forward.
Representative O'Neill.
Thank you, Mr. Chair. Thank all of you for being here. Obviously, this is a very serious and sad discussion we're having. Excuse me. But I want to ask a couple questions do you receive funding from the Michigan Trust of Michigan? And also, the 5 counties, Mr. Brace, I think you mentioned that does not have the CACs. Which counties are those? And then what is the conviction and prosecution rate of the perpetrators? And do you work with local community, county, let's see, CAN Council in Saginaw? We have an organization. You guys work with that organization and local organizations? I know that's one question, but 3 questions.
Can I answer one question and then I'll turn it over to others? In terms of the prosecution rate, I don't have an exact number or percentage on that, but I can tell you, and I think it's a really important part of the work that we do, is that from the very beginning, we are working to avoid kids having to take the stand in a trial. And so we see a lot of convictions. Ideally, they're coming from a plea. And so we build investigations that are so strong from the very beginning. Our prosecutor that works with the CAC, he's known for being able to deliver some pretty significant sentences, especially if you take the risk of taking it to trial. And so I think that's been really helpful in our county to build that momentum around people knowing if the CAC is involved, that's going to be a strong case, and that we're able to get that conviction, get justice for the child and family, but without having that aspect of having to go on the stand.
So there are 5 counties, Ontonagon, Gogebic, Cass, St. Joseph, and Monroe County are the 5 that don't have a formal agreement with the Children's Advocacy Center. The way Children's Advocacy Centers typically work is they'll have an interagency agreement or a county protocol that embeds CACs as part of the process. It's part of our accreditation standards with the National Children's Alliance for Children's Advocacy Centers to create these agreements with counties. Those 5 don't have formal agreements, but all 5 will receive courtesy services if they reach out for those services. I can also tell you that 3 of those 5 counties, the 2 in the UP and 1 downstate, I think St. Joseph, are also in some discussion of working more closely with their local children's advocacy centers. I forgot some of the other questions. If you would
CAN
like to repeat them.
Council.
Child Abuse and Neglect Council.
We do work with the Child Abuse and Neglect Council. And in fact, some Child Abuse and Neglect Councils are the Children's Advocacy Centers for their community.
Thank you. Thank you, Mr. Chair.
Could you repeat the 5 counties, please?
Sure. It's Ontonagon.
Can you spell that, please?
Yeah.
Just
I did some homework last night. It's Ontonagon, Gogebic, Monroe, Cass, and St. Joseph counties. Those are the ones without formal agreements, but I can speak with certainty that at least 4 of the 5 are getting served through courtesy services from their local CACs, some combination of the CACs in the surrounding area.
Okay. Representative Slaw?
So part of the request that you have is a $6 million increase. And I'm wondering if we could do that magically today, like that, could we put people in those positions to actually make it happen? Or are we creating capacity without having the bodies, the people to be able to fill it?
Yeah, that's a great question. I think it's a great question because I think it's a really layered question. I think there have been times, that we have experienced difficulty, if we talk about like therapists, like filling therapy spaces. We're in a mental health shortage and crisis across this country. We don't have enough providers to be able to meet the need for the people that actually have, mental health concerns. But I do feel confident that, what our local CACs have built are programs that are very trauma-informed. I think they're very attractive. I think especially if you're looking at like new hires into this type of work. We employ people not only from like, social work and counseling, but criminal justice, prosecutors, attorneys, things like that. So I think that if we were able to secure this funding now, I think we would be able to make a very concerted effort to fill those gaps. I think there would be a lot of momentum for us to be able to see that. I think we all have an understanding of where we need to fill in the gaps, and I think we would be able to fill those. I feel very confident about that.
I wanted to add, and I think some of my colleagues have some other thoughts to that, Representative. We're hemorrhaging staff right now. CACs are seeing a revolving door that many of our other agencies around the state are facing. Funding helps provide stability for the staff we have. There is a pretty tangible ceiling for professional development in our space. Once you get to a certain spot, we're getting poached by the FBI and Homeland Security. They're going on to do great work, but they no longer have the ability to stay at CACs. So we will be able to both retain the professional expertise we develop locally and recruit and fill spots. In many of these areas that are served by Children's Advocacy Centers, you have one person who is leading the charge in some of this expertise. I'm speaking to forensic interviewing specifically. When they get sick, there's no backup. If they decide to take a new job, children are going unserved. The increase in funding allows us to provide support to all of the critical services at CACs. I think Mr. Henry has something else to add.
Thanks for the question, Representative. What I wanted to say as someone relatively new into the CAC world is the financial modeling is really peculiar and difficult to manage. It takes a long time to wrap your head around the funding. And I find myself at this time in Lapeer County, because of some good budget management and some unknowns because we moved buildings. So our budget right now is in a place where, excuse me, I'm confident I can afford a counselor and another therapist for the remainder of this fiscal year. But I'm not confident what happens on the 1st of October. So I can't really, in good faith, hire that person because they might not have a job on the 1st of October. So the funding that we're asking, that security, would erase a lot of the scarcity mindset that we have to operate in and the uncertainty from year to year. When I first started, I was stunned at the amount of my effort as an executive director that is going into just trying to manage this scarcity, just trying to see what we can do. For us in Lapeer, as a small CAC, that means when, as Mr. Bissell was saying, when staff leave, there's simply responsibilities that are not covered. For us, at the moment, we are lacking in our ability to do the prevention work in our community. And right now, we can't afford to hire someone to do it. We are doing the counseling work, but not with enough to cover our waiting list. And we are doing the interview work and the advocacy work, but we're not doing all the work that we should be doing and that we could be doing.
Representative Vice Chair Price.
Thank you, Chair. Thank you for being here today. I'm curious, how are other states funding these kinds of programs? Where are we ranked, and what can we learn from other states in terms of doing this better?
All right, that's well above my pay grade, Mr. Bissell, I think, or Alex.
Getting our steps in.
So I think as far as the funding across the country, we are, I think we have the third or fourth most CACs in the country. So we're doing a great job of coverage as far as our state is concerned. But our funding, again, we have that $2 million appropriation that's been given to us this year, which we're obviously very grateful for. But when we look at some of our other surrounding states, we're kind of going through and actually like trying to assess that right now and see exactly how much it is. So we can definitely get back to you with some stronger numbers. But I think that last I knew, Illinois, I think, had an appropriation of about close to $12 million for their CACs. But we are kind of digging in to see sort of what's the standard across the country, and especially like comparable to the amount of CACs and the amount of work that's being done within the state.
Only wrinkle I can add to that is if you look at kids count data, which is a great place to see some of the general statistics and trends in child maltreatment. They have a classification system. I can't speak to their classification system, but Michigan is ranked in the worst category. And this is based on national averages. So that might also give you a sense of where support and funding is for this programming.
All right, a couple more questions. Representative O'Neill?
Mr. Chair, on that note that you just made that comment, Michigan is ranked worse throughout the entire United States, is that? And then are there factors that you can point to as why we're at the bottom of the barrel, so to speak?
We're not at the bottom of the barrel, but we need to see more universal support from the top down. We need to see teams that are motivated to collaborate. We need to see more resources invested in developing consistent protocols for investigative response. I could spend a lot more time talking about what we could do to improve the system, namely improving our capacity through funding support will help us provide more services to the community and the partners that we work with. I think there's also disparity between certain communities. Some communities just don't have the same access to training resources or the ability to the representative's point, recruit the right talent because they can't make a meaningful offer or presentation. So we need to be able to retain the talent we have, and we need to be able to spend less time seeking support, to Mr. Chair's point about all the time spent in development and fundraising efforts. That time could be spent building community awareness, doing training and education, and providing core services. A lengthy answer. We could probably talk a lot more about a blueprint for improving the processes, of which the CAC is just one part of, but we have a relationship with all the other entities, with Michigan Department of Health and Human Services, with law enforcement associations and local entities, and with all the other vested professionals that are doing this work. And CACs are the only ones, as far as I know, that are sworn to collaborate with each other. So well-funded, well-supported CACs will have an impact on every layer of the community's response to child abuse.
And Mr. Chair, if I may, just lastly, with that being said, sir, CACs being sort of the hub of the spoke, I would hope there is a web, web meaning the triage process, and then those gaps in terms of, as you said, there are so many layers to deal with. I would hope that, Mr. Chair, this committee probably would want to see that, particularly with the increase of funding. What are the gaps? Where are we missing it? What do we need to do to modify certain connections to elevate our effectiveness, if you will? We being in the last, I'm not sure how you rank that, I just said bottom of the barrel, but that's my point being is, why are we there? And so that bodes the question is, what do we need to do to improve? And so is there a tool that you have to show us, to tell us that you've looked at, you've made some assessments to determine those areas that we need to really strategically focus on to make those improvements? That's just, you don't have to answer that question now, but that's from that analogy, Mr. Chair, I would be interested in seeing what are we doing as a CAC hub to address the structural failures, if you will, to have us rank in the lowest of the threshold of service throughout the United States, for the question my colleague mentioned. So thank you, Mr. Chair.
I do have one thought to add to that, Representative. CACs have to engage in conversations with their community partners, look at investigative protocols, measure our successes, look at our failures. There's a case review process requiring CACs to meet monthly to look at live cases where there are still decisions to be made that impact child safety, to work with partners and develop strategies, and to analyze the robust data points that every CAC must collect. So we are collecting data on outcomes at a local level. We are collecting our dispositions from our law enforcement and our prosecuting partners. I don't have all of that data today, but if there are specific questions that this committee has, it's not a reach for us to bring that back to the other 36 CACs not represented here today, ask those questions and collect that data. It would be our honor to provide you some answers to those questions.
That would be great. Earlier in the presentation, Sydney mentioned 28 or 30 Child Advocacy Centers had received funding. You keep mentioning 40. Why are those 10 not receiving the funding?
That is not something that I have an answer for. It could be that there are some advocacy centers, Josh, you might know the answer to this, that are not fully accredited. And I know for some of the funding opportunities that we have in the state, full accreditation with the National Children's Alliance, which is our accrediting body for all the CACs in the country, that is a requirement in order to receive some of the funding that we get from the state. So that may contribute to some of that discrepancy, but we could also look further into that and provide an answer for the committee as soon as possible.
Yeah, absolutely. I'm not sure where the discrepancy is. I can tell you that 7 of the 40 are in a developing status, working towards accreditation for the first time. So 33 fully accredited programs at this point.
Okay, you used the term multidisciplinary multiple times. What disciplines? Where do they get their training? And then would that also include like your SANE nurses? So I believe there's a line item in our budget that tries to help. My wife was a SANE nurse, and so I believe there's a line item in the budget to help nurses become SANE nurses. A SANE is a sexual assault nurse examiner. So when you talk about multidisciplinary, you may have hit it. Can you just quickly list your disciplines?
Yeah, law enforcement, child protective services, medical, which includes SANE nurses. Thank your wife for the work she does, please, Mr. Chair. That also includes sometimes physician assistants, sometimes child abuse medical pediatricians, or just pediatricians with didactic training and diagnostics of child sexual abuse. That includes mental health therapists, that includes victim advocates, includes the prosecutors around the state. Am I forgetting anything? And that's just the routine multidisciplinary team. In some communities, they're involving their schools, they're involving other like prevention arms, like Ms. Rachel mentioned. There are some communities that have other special interest groups that are part of the table. Some involve their local religious organizations as part of the community response. So we're getting creative out there, but we need more support. Any more specifics about those disciplines, Mr. Chair?
No, I'm good. And then one more question from me. Changing the gears just a little bit. What do you do to keep your employees from emotional spillage or breakdown?
It's a great question. I think, a lot of it is, there are some practical things I think that we do. I can speak to small talk, and I would love to hear from my colleagues as well. We have a pretty robust paid time off system as well, so we make sure that people take their time off. I think as the leader of the organization, I have to kind of set the tone for being the person who actually takes time off so other people can see that they can do that as well, which is a challenge, I think, sometimes. And I have some people that will hold me to task, which I am very, very grateful for. Additionally, I think, having a team of people is really important. When I first started at our CAC, I was the only employee. So I was there serving 30 clients, doing every job but being a forensic interviewer at the time. So I think just being able to have a community, within our office that when we need to debrief, every day is a hard day at a CAC. But I think what it can be for those kids is it can be the best part of a really hard day. And I think that when we have sort of a shared vision of what it is that we need to do to make sure that these kids are okay, it makes taking care of ourselves a little bit easier as well, because we know that we can't give from an empty bucket. We have to be full. So I think it really is a lot of staff camaraderie. I think that helps as well. I know many of us here today have canine advocates, dogs at our office. That is immensely helpful, I think, for us, because they can provide some unconditional support to us that you just can't get from a human. So yeah, I don't know what else you have, Trish.
Yeah, I'm going to reiterate what Alex said, which is we do a pretty robust PTO, so that way they can pay time off so they can take their time. We do put things in place where they need to use most of that time throughout the year. We do that on purpose, so they're not trying to hold it and carry it over to the next year. We want them to use it. We also will look at different, we have something called the Care Committee or Health and Wellness Committee, where they develop different, we want to educate them on secondary trauma or vicarious trauma that they may experience and coping skills that they can use to address that. We also have a system in place for our supervisors, so that if somebody comes to you or you notice something, they're having a particularly rough case, and you notice certain behaviors, that the supervisors have steps that they take to make sure that they're following up, making sure that they're filling in for things. There's also a there's a state trauma response that you can do, that you can get some pro bono therapy for, which is using EMDR. I'm going to try to remember what it all stands for. Eye movement desensitization reprocessing. Anyway, hey, I haven't been trained in that one, so I'm not sure on that one. But there is actually a state network that will provide some of those sessions pro bono to people who are frontline staff. So that has been helpful as well. I did want to, if it's okay, address something that you said about training. Something that all of us do as CACs is we provide regular training to our law enforcement, child protective services, prosecutors on a regular basis. Like in Oakland County, we do a monthly orientation with all new child protective service staff to come in and learn about sexual abuse. As much as it's just not talked about in society, it's also not talked about in a lot of investigations. And so we do orientations for all of our new law enforcement. We go out and train entire jurisdictions at a time on what all of this is about, as well as our process to get cases into us. So we are consistently providing regular, we have an annual conference that we will send some of those representatives to as well. So I just wanted to address that. We're heavily involved in some of the training as well, because a lot of jurisdictions really say they'd have no information.
Representative O'Neill.
Thank you, Mr. Chair. Just my final question. What are the best practices from the top 5 in the country in terms of service delivery models that they are doing that we can learn from, or are we reaching out? Do we look at those in terms of what we do based on the top 5? I just use the top 5 in terms of is that any efforts and practices that we utilize to try to learn to be better? I know this is a tough issue, so don't take what I'm saying as a direct attack to you, but this is serious, and we all know this. And so that really just hit me like a brick when you said that we were where we were in terms of our level of standing, and then we asking for more money. So I'm like, whoa, hold it. But what are we doing to try to improve ourselves? And, what metrics are we using or getting from those top 5, per se, that we can say, oh, wow, they're doing this in this state, they're doing this in this state, and they get great outcomes. So what are we doing that practice? Or?
One thing I know that we can address that we have looked at, we have our public policy work group in the past, and it's not something that we're doing currently because of the looking at the priorities of funding and things like that right now. But there's a lot of states that are probably what you would call the top 5 in response, where the Child Advocacy Centers activities and actual just recognition of them are codified into law, so that they actually recognize through the state law what a Children's Advocacy Center's role is, and they recognize that as part of it. So that's one of the strategies that some of the states are using. It's also a way to sort of monitor things and make sure that they're doing best practice. So I know that's something. We can get you more information, though, on what some of that is. We have looked at a lot of that. I just don't have it right in front of me. I apologize.
I was just going to comment that there are over 960 Children's Advocacy Centers throughout the country. We are accredited by the National Children's Alliance. That involves having now 9 accreditation standards that we have to meet, and these standards are very rigorous. The accreditation process is pretty intense, and so there's not really another like model out there or I would say that we have a pretty clear sense of what best practice is, and truly at the heart of that is using that multidisciplinary team. And so I think strengthening those relationships, making sure that you are well coordinated and well connected, that is best practice, truly. And that serves kids and families incredibly well when we are all working together for their benefit. But I would say that the blueprint or the rubric is laid out essentially by the National Children's Alliance, and then I think it's a matter of meeting those standards, which we all do, but then also just being able to keep up with the demand for services. And I think as well, coming from Ottawa County, we are blessed with a really incredible facility, and so I think that's a room for improvement for Children's Advocacy Centers throughout our state, and I think that would be something that with additional funding, we could put more into our capital needs. I know we have a facility that is well set up for what we do, but that's not the case in every county, and that makes such a big difference to the experience of a child and family. I believe that especially with all of our services being free of charge, for a child and a family to walk into our center, it's beautiful. We have 4 different local artists that we work with. It's colorful, it's bright, it's welcoming. And for kids and families to walk through our door knowing they're coming in for something so difficult, so heartbreaking that they've had to deal with, and to be met with that, I think it communicates dignity, that you are deserving of care and treatment in this place with the most talented team of clinicians. There's not the barrier of payment with that. So I think that's a major opportunity for improvement because it does matter. And also when it comes to taking care of the staff, the space matters too. We have a respite room on site with a treadmill and a couch and some weights and that type of thing. And that because of our facility, we are able to design it in a way that ultimately cares well for our clients and families, but then also for our staff too.
And I think I just wanted to add as well, when we're talking about the funding ask that we have, brought to your attention today, the key for us is that the more funding that we're able to receive, we're going to be able to reduce those wait times for therapy because we'll be able to employ more therapists to be able to meet the need. I think as this has continued to grow, the funding has had to grow with it. The better that we do our job, the more that we're out there, bringing awareness to this really serious issue, the more people are going to come forward. And it's our responsibility to be able to meet the need. And I think that's where the additional funding comes in, is being able to hire more of those people, be able to dedicate more of that time to programming. And I think that's what ultimately is going to move us up that list, in that ranking, is if we can get to people before they decide, I've been waiting 4 months, I don't feel like I need therapy anymore. If we can get to them within a week or 2 weeks and get them the services that they need, those long-term impacts of child abuse will diminish. But the support is absolutely essential for us to be able to meet that need.
All right, we have a hard stop coming up. Thank you. Thank you for traveling today. Thank you for coming in really from all across the state. And maybe we can touch base here in a couple minutes. We have one card turned in from Jim Casha from the Foster Adoption Kids with Fetal Alcohol Syndrome Disorder. He had asked to speak, but it appears he has left. So just as a note, Madam Clerk, that he was here. Representative Kuhn moves to excuse absent members. Seeing no dissent, so moved. And that being the case, this closes Representative Price moves that we close. Okay, that we adjourn. She adjourned. We are adjourned.
Thank you.
I thought we didn't.